Mr. Vice President, it's Willie Geist. Good to have you on this morning.
Hey, Willie.
Yesterday at this time, we got word that 3.85 million Americans had filed for unemployment just in the last week. That brought the total to more than 30 million of our fellow Americans over the last 6 weeks out of work. So there is a balance that governors are trying to strike right now, from Florida and Georgia to Connecticut and Colorado, of when to get people back in. So what do you say to people who you're talking to in Wilmington or talking to on the telephone these days who say, I get that this disease is bad, I get that it's highly contagious, but the alternative here is me sitting losing my job, watching the small business that I spent my whole life building evaporate? That's worse to me than at least trying to go back to work. What's your message to those people who are out of work or who own a small business and are really hurting right now?
Well, first of all, it's a false choice to choose between getting the disease under control and getting it back to work. If you don't get the disease under control, not much is going to happen. We have to get the number of new cases down and down significantly. There needs to be widespread, easily available, and prompt testing. The federal government should be doing more to make this happen. We have to make sure that our hospitals and healthcare systems are ready for flare-ups and the disease when it's going to occur as economic activity increases and expands. And in the meantime, all the money that's been passed out by the Congress, very little of it is getting into that person that fictitious person you described, a small business. One of the things that I predicted when they passed the legislation, remember, there's an oversight that was supposed to take place, an inspector general. The president got rid of the inspector general. I was put in charge of getting, in the middle of the recession, the last recession we had, the major recession, $800+ billion out to help people get back to work and to help things get set up. We had an inspector general. There was an entire team I put together. I was on the phone every day, about 3 to 4 hours a day, talking to mayors and governors and people, letting them know what's available, how we could get something done. It requires immediate and consistent and overarching focus on what has to get going. And right now we're in a situation where we have an awful lot of small businesses being told by the big banks, you're not in line. You don't get it. You're not. And we should be moving in a direction to keep people on the payroll. That's what the money said, that the money was going to go to larger operations. The condition was keep people on your payroll. We should be allowing people to work, as they say, basically half time. Instead, if you have 10 workers doing a job and you only need 5, keep all 10, make the difference up. They split the jobs and make up the difference in their salaries by the federal government in terms of the stimulus. There's a lot of things that we can do that can fundamentally change the trajectory so that when this finally does get under control, you still have everything from those barbershops to those hardware stores or those small drugstores. They're able to be open, but when they're gone, they're going to be gone.
So, Mr. Vice President, you made a comment last night in an interview with Bob Costa of the Washington Post where you said, I view myself as a transition candidate making way for the Mayor Petes of the world to come into my administration. Some people read that as you saying you were sort of a placeholder and that, don't worry, I'm going to open the door to this more progressive movement, perhaps led by Bernie Sanders and Elizabeth Warren, Alexandria Ocasio-Cortez and others. What did you mean when you called yourself a transition candidate?
It doesn't have to do with philosophy. It has to do with we have not given the bench, the younger people in the party, the opportunity to have the focus and be in focus for the rest of the country. There's an incredible group of talented, newer, younger people. I ran this time because I think the issues that are before us happen to be in my wheelhouse. I said from the beginning, we're going to inherit a divided country as well as a world in disarray. They're the two things I've worked on in my whole life. I've been able to get things done in the United States Senate and as vice president with the other party without making them the enemy and get things done. Unless we can reach consensus, this democracy is in trouble. And secondly, I have a significant responsibility and significant experience dealing with the vast majority of the world leaders to put back in play our role in the world. We are in, America First has made America alone under the Trump administration. Our alliances are in jeopardy. Our ability to lead the world. Willie, we have led not just by the example of our power, but by the power of our example. And we've walked away. Look at what's happened with regard to this pandemic. The pandemic is that the president has no intercourse whatsoever with the rest of the world on dealing with these things. We led, like Barack Obama led in the in the pandemic that occurred when we were in office. It was kept in Africa. We organized the world. Yeah. We put things together. That's our job, because if we don't do it, no one's going to do it, as you're now seeing.
Mr. Vice President, will you, as we close this interview, love for you to say a word or two about public healthcare work, about healthcare workers, about nurses, about doctors. We heard the tragic story of a woman who was in charge of the ER at a New York hospital, taking her life because she was so despondent. What are you going to do? What will your administration do to support healthcare workers, not just on the job, but also off the job, perhaps with many of the mental health care challenges that they are going to be facing for years to come because what they have seen already this year?
They are going to face it. A lot of people are going to face it. Look, Joe, over 600,000 dead. Many of them are people who are those workers, those nurses, doctors, some of them, because they have put themselves in a position to save other people's lives, protect the rest of society. And we talk about that number like 600,000+ people. There's each and every one of them left.
60,000. Yeah, 60,000.
660. I missed 60,000, over 60,000 deaths. And we talk about them like they are a number. Every one of them left behind a family. Every one of them left behind friends, left behind. This is one at a time. They have to be recognized for what they have done. And I hope it opens up the eyes of the American people, which I think it has, to realize there's so many people every day out there breaking their necks, from people who are making $7 an hour to significant medical professionals. And they're all risking their lives for us. I think we have a chance to fundamentally change the societal structure and how the inequities that exist in our system once we get through this, because people now realize these are the people making a difference. First and foremost, recognize their sacrifice. They're not asking for that, but they have to know, and it's part of what I've learned, you have to know that what is needed is you have to be recognized for people knowing that you are doing something good and decent and honorable, and you're doing it for other people. It's about some empathy. It's about letting them know. But beyond that, that's why I propose, in the healthcare proposal I put forward, that we significantly increase funding for mental health. We make sure that it's the same level as physical health. There's no difference whether you have something wrong in terms of your emotional state and your brain, and any more than it is if you broke your arm. And we have to lift that whole notion that somehow there's something that makes you less of a person if you acknowledge you're having serious mental problems. It's predictable. This is going to happen. And we have to be there to catch them. We have to be there to help them. We have to be there to reinforce them. And that's part of our societal responsibility. And as president, it'll be a major part of what I do in the health side of this.
All right, Mr. Vice President, thank you so much for being with us this morning. Good luck and
thank you.
Thank you very
safe.
much.
All right, in this programming note, he will also, there will be Reverend Al Sharpton's show, Politics Nation, and Vice President Biden will also be his guest tomorrow at 5. We have a lot more to come. Nobel Prize winner Paul Krugman is going to be our guests when Morning Joe comes right back. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.